So today we're going to be measuring blood pressure. I gave you that handout a few minutes ago just to glance over. So blood pressure is trying to measure the pressure of blood that's going through the system. It's the force of the blood hitting the walls of our veins and our arteries. And we've all got our blood pressure taken when we go to the doctor, but why is it important that we actually take it? If we know that someone has good blood pressure, we'll be able to kind of see what their overall health looks like. And I know, like, as PTs, you're like, why do we have to take blood pressure? Like, doesn't the doctor do that? Well, we take vitals as soon as we meet with the patient. So we will measure this as PTs. And another thing is that if someone does have high blood pressure, it's not always going to cause symptoms. So they can be walking around every day, have high blood pressure and not even know it, and then it could cause like further problems for them. So there are multiple arteries that we can use to take blood pressure. The most common one is the brachial artery, which runs right here. That's why we always wrap around this part of the arm. We can also use the radial artery, which is down here. It's not as common. And then there are also some in the leg. The only reason why we would do that is if someone has a bunch of like IVs in their arm, or if they don't have an arm, or something like that. So how should someone prepare for the test? They should sit in the chair with their back flat against the back of the chair. Their legs shouldn't be crossed, so can you please thank you? And you should just have them hang out for like 5 minutes. So when you go to the doctor, they kind of talk to you for a few minutes and then they end up strapping the blood pressure cuff on you. So once they're in the chair, you take the cuff and it will have a range on it. This is to be able to measure to see if you're fitting the right size cuff on the patient. So when I close it, it should be within the range. If it doesn't fit, then you just have to get a smaller or bigger cuff. So first, you can roll up their sleeve. You can ask them to roll up the sleeve. I usually just do it myself. My hands are usually pretty cold, so I tell them my hands are cold. And you also want to be eye level with them. If I'm standing like this, it's not very good posture for me. I could get hurt, so I like to sit in a stool. You just have them relax their arm at the level that their heart is at. So this is fine. Sometimes you can put a pillow underneath just to make it more comfortable, but this is cushiony, so it's okay. So you grab the cuff. I always ask the patient to hold these two with their opposite hand that I'm not using. So I ask them to hold it, and then I take the cuff, and I wrap it around. You can move if you can't see it anytime. So this is in range, so this cuff fits her. These two cords should be on the medial side of her arm, which is the inside of her arm, right where that artery runs. So then you just pull it tight, wrap it around. It should go about 1 inch from this crease. So can I see your arm? You can just bend it a little bit for me. Bend it. So here's the crease, so I can actually move it up a little bit more, about 1 inch. Keep it really tight. Is that okay? Does that feel okay? Okay. So once it's on, you can clip this. There's a clip on the back to their shirt, or you can ask them to hold it. I always just clip it here. And then the next step is trying to find their artery through their skin. So the best way to do that is to have them extend their arm as much as you can, and you'll take your 2 fingers, middle finger and pointer finger, and palpate, which is just pushing on the skin or muscle or bone or wherever you're trying to find. In this case, it's the artery. So once you come over it, you can feel around. Some people's are a little bit more inside or outside. You'll be able to feel it bumping underneath your finger. So then you can tell them to relax. And then you take the diaphragm of the stethoscope, which is the big part, and you'll put it right over top. So first, you can come over here, and I'll give you this opposite one. If you want to pull the chair over, you can do that so you can be level. So hold on to these real quick. So these are called binaurals. They go facing inside your ear. Okay. So inside, like that. Like that? Yep, like that. And then when I tap this, you should be able to hear it. Okay? So, like I said before, sorry, you're just going to have them extend, palpate, feel it right there. So now you can relax your arm. I'm gonna put this diaphragm, which is the large part, right here. It shouldn't be underneath the cuff. It should just be resting. It's a little bit, but shouldn't be completely underneath of it. Okay. So then I'll put those in my ears, and then I take this inflation pump, and I'm gonna pump it up to 170 on here. So how you do that is this is the valve. You flip it all the way to the right. Ready, tighty, lefty, loosey kind of thing. All the way to the right, and you pump, 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 till it gets to 170. Then you're gonna turn it to the left, let it out slowly, and then when you hear the first beep or click, or you'll hear a noise, that's the systolic blood pressure, which is the first number, and you'll hear noise, and hear noise, and hear noise, and then eventually you won't hear any noise. That's the diastolic pressure. So then you release it all the way out, all the way to the left, tell her to relax, and then you record the number. And then based on the number, you'll be able to tell if they have higher blood pressure, normal blood pressure, or if it's pretty low. Okay. And all we do is record. We're technically not allowed to tell someone that they have high blood pressure because it's out of our scope of practice. So what we would do is just make a note and then contact a physician or something like that, okay? So we can put these in our ears now. Let me know if you can't see. Okay. Okay, so can we extend just so I can find it one more time? Good, you can relax your arm. Thank you. Alright, can you see? Okay. You should be able to hear when I start pumping it up. That was the first one. You see that? And there's the last one, where I stopped. You couldn't hear it anymore. So hers was 100/70. That's how you would write it, top number or the bottom number. So could you hear like the first little click and then kept going, and then it would stop? Okay, cool. So then we usually just wait a few seconds to get everything to relax, and then we would take it again. We can take it in the other arm just to compare. We usually do everything bilaterally, so what I would do on one side, I would do to the other. But like when we go to the doctors, they kind of just do one arm and then everything's fine. But if there was a concern, I would definitely take it on the other side. Her blood pressure is a little low. It's usually low, so it's not really alarming or anything because I know this patient, so I know what hers usually is. But if I didn't know her, I would definitely make a note of it and see what was going on. So I'm actually going to take it one more time. If you have to move over at all to be able to see this better, you can. Same thing. I'm just going to have her extend her arm, palpate here, right here. So if you want to put your fingers under my fingers, push a little hard. Can you feel it bumping underneath your fingers? Good. So you know to put it right here. You hold it, tell her to relax, all the way to the right. Can you see this? Okay. So pump it up 170. A little bit higher, 102/70. It went up a little bit. And then what you would do is, I can take this. They usually don't have two. It's just this one has two. You would just undo the cuff, take it off of her. Thank you. And continue on with whatever you're doing. Okay. So now I'm going to ask you to do it. I'll be there for if you need any help, you can ask me. Okay. Alright, so can you please roll up your sleeve? Yep.
Does it need to be super tight or?
If it comes down a little, like that's a little loose.
Okay.
You can always ask your patient to hold that part for you also. Just so you can make it a little tighter. There's nothing wrong. Whatever's gonna make you get the best number and the best measurement. That's good.
Okay. Good. Do you need one of these?
I do.
Okay. Sorry.
Thank you.
Yeah.
So, which way should I put these in then?
Facing that way. I'm not sure what that. Oh, this way.
Yep, into your ears, just like in your ear canal.
Yeah. Okay.
Yep.
Sorry.
No, all good.
I did it that way, so like as if you were.
Oh, I
Yeah.
gotcha. Yeah, then you were. Yeah, we were.
Okay.
Good.
All right. Okay, I'll put them in for now. Okay.
Should be a little thing to squeeze on the bottom. Make it a little.
I see it. Okay, there we go.
Not all of them have them.
Okay. Alright, can you stand your arm here?
Cool.
You hold that? Yeah. Thank you. Okay. Is that a good pace? Oh, I forgot to say now.
No, you don't have to say
Oh,
that.
okay.
I'm just saying that so you can know what you were listening for. Did you
Okay.
get a number?
I got about 90 over like 70.
Yeah, the bottom number was 70. I
Okay.
got
Like, I think like 100, between 100 and 90 maybe.
yeah, I got 100 again.
Okay.
So it's fine.
Okay.
You can just wait a few minutes. It might start getting a little higher because we keep taking it on.
Okay.
So we can just. Do you feel comfortable enough to we can do it one more time?
Yes.
Okay.
Okay.
This time I'm gonna try not to give any cues.
Okay.
Okay.
I got about 170.
Yeah, it was pretty much the same. Yep. All right. Well, then you can just take everything off of her now.
Okay.
And there's a lot of glue and everything.
Yeah.
you do blood pressure measurement. So like I said, at the end, you would just write down whatever numbers that you heard. There is a chart on the back. You don't really have to remember it. 120/80 is normal, and then it kind of goes up by 10. So then 130 is pre-hypertensive, 140 is hypertensive. That just means high blood pressure. Hypertensive is the same thing as high blood pressure. So you wouldn't tell the patient, hey, I think you're hypertensive. You would just write it down, make a note of it, and then continue on with